All right. Thanks again. My second topic today is on a discussion of contralateral prophylactic mastectomy, a nice segue to Dr. Bagaria's talk. We're going to specifically talk about considerations and counseling, and I'm going to really do an in-depth review of the literature that will help in counseling patients with regard to oncologic outcomes for CPM. I have no disclosures. I wanted to start by introducing this article that was published in the Wall Street Journal a few years ago, and I think it's an excellent example of the social media influence over breast cancer patients and the fact that breast cancer is one of the most commercialized diseases with a significant amount of publicity. One thing to note about this particular article was what I've highlighted in red, and she stated in this article that one piece of advice she wasn't planning to follow was her physician's. So she had been recommended a unilateral mastectomy with adjuvant treatment, but she was involved in a number of support groups and had experiential knowledge with family members undergoing treatment, and as such did desire to have both breasts removed. So we'll talk a little bit about patient choices and whether or not they're justified. I'll briefly touch upon trends for early stage breast cancer. This is a nice follow-up to Dr. Bagaria's talk in the California Cancer Registry. We'll talk about women's choices for mastectomy from qualitative studies that have been performed and whether or not these choices are justified. And then we'll look at the consensus guidelines, which is just really a review of all of the evidence that I'm going to present, and finally a summary. So surgical therapy for early stage breast cancer has evolved significantly over the past 2 decades in particular, and as such, women now have the choice, or the majority of women now have the choice between BCT with radiation and mastectomy. And that's because we have seen in several studies that there is equivalent survival and similar outcomes between these two methods of management, particularly for early stage breast cancer. In 1990, the NIH released a consensus statement stating the equivalent outcomes between BCT with radiation and mastectomy, and actually stated that it was preferable as a result of preservation of the breast. Shortly after the release of that statement, we saw a precipitous decline in the utilization or desire for mastectomy and a parallel increase in utilization of breast-conserving surgery. In fact, for patients with stage 1, BCT increased by about 25%, and for stage 2 patients by about 10% over a 6-year time period, which overlapped with the release of that NIH consensus statement. In recent years, though, as we saw from the line graph presented by Dr. Bagaria, we have seen a decline in BCT, but without a similar decline in